Inevitably, when the topic of treating injury or treating pain comes up, we have to talk about cold therapy versus heat therapy. So what is better, ice versus heat? Instead of just giving you my opinion on the topic, we're actually going to go through what the research says. And we found a pretty cool study in the Journal of Postgraduate Medicine. It's a review, so it takes all the available research and looks at the results of that research and gives it to us in a digestible manner to decide, okay, should we be applying heat? Should we be applying cold? The study is called Mechanisms and Efficacy of Heat and Cold Therapies for Musculoskeletal Injury. So, pretty cool study, and we're going to go through what it found. All right, so we're going to start with cold therapy. Okay, so there's different types of cold therapy that can be applied. You can do the old frozen bag of peas, an ice pack, cold bath, like an ice bath. There's also cryotherapy chambers that are out there. Most of these studies looked at a cold pack or an ice bath. All right, so what does applying cold actually do to the body, or what do we think it actually does to the body? So here are the mechanisms for applying cold or cold therapy. So we'll see decreased skin and muscle temperature, decreased blood flow to the area that we're treating, decreased cell metabolism, decreased inflammation, edema, pain, muscle spasm, and decreased muscle elasticity. Okay, so those are the perceived, or the mechanisms that we think are occurring when we apply cold. So the study a lot of these studies looked at what cold therapy does for acute musculoskeletal injury, so injuries that have just happened, and most of these studies looked at ankle sprains specifically. Okay, so it found that applying ice decreases perceived pain, but there's little evidence to say that it decreases swelling or range of motion. Okay, so we saw improvements in pain, but not too much when it comes to swelling or range of motion. Now, if you've ever had an ankle sprain before, decreasing pain can be a pretty cool thing. So applying ice can be good for that, but might not help with the swelling or range of motion. One study also found that intermittent icing protocol, meaning 10 minutes of ice every 2 hours, as opposed to just applying 20 minutes and then being done with it, was superior. So it's better to apply ice every 10 minutes, or for 10 minutes every 2 hours, than just for 20 minutes and being done with it. All right. Some of these studies also looked at applying ice versus the old RICE protocol. The RICE, if you don't know, stands for Rest, Ice, Compress, Elevate. It actually found that applying ice was just as beneficial as going through the whole RICE protocol. So instead of going through the trouble of doing the Rest, Ice, Compress, Elevate, you can just ice. All right, so in summary, ice has been found to decrease pain following acute ankle sprain. The other thing that a lot of these studies looked at was ice or cold therapies improvement on delayed onset muscle soreness. So we call this DOMS, okay? So if you work out really hard, the next day or 2 days later, your muscles are sore, that is called delayed onset muscle soreness, or DOMS. Okay, so these studies found that cold water immersion versus rest was significantly superior for decreasing levels of muscle soreness at 24, 48, 72, and 96-hour follow-ups. So better do cold water immersion for sore muscles than just resting at those follow-up periods. Okay, it also found that multiple daily applications of ice, multiple applications throughout the day, was superior than just one, similar to that ankle sprain study, but that might not be feasible for most. I don't know about you, but if you have a busy schedule, you might not want to be spending 10, 20 minutes every hour icing your sore muscles, okay? You do it once and you're done with it, and you can see some improvements in muscle soreness. Okay. So these studies also looked at some of the complications of applying ice. We need to make sure, is it actually safe to be doing? Okay. The complications included frostbite. So ice is too cold, or the cold therapy is too cold, and it can freeze the tissue, so we want to be careful of that. They've also seen neuropathies or nerve damage to some of the superficial nerves if the ice or cold is left on too long, so we want to be careful of that. But those neuropathies, when it has happened, they have recovered. Okay, so don't leave the cold therapy on too long, and make sure it's not too cold. So now we're going to get into heat therapy. So there's different types of heat therapy that we can do as well. You can do a heat wrap, moist heat, the old heat pack that you plug into the wall and put on your back when it's sore, or a warm bath. Those all fall into the heat category. Most of these studies looked at like a warm bath or a heat wrap. Okay, so what are the mechanisms of applying heat? What do we think that applying heat does to the body? Okay, so we're going to see increase in skin and muscle temperature, increase in blood flow to the area that we're applying the heat to, increase in cell metabolism, decrease in pain, and increase healing and elasticity. All right. So what does heat do for acute musculoskeletal injury? So we're going to look at the same kind of thing that the cold did, but most of these heat studies looked at heat for acute lower back pain. Okay. And they found that a heat wrap provides small but significant short-term reductions in pain and disability for those with lower back pain. Okay. So if you've ever had lower back pain, having some decrease in pain and decrease in disability can be really important. So they have found that applying a heat wrap can be beneficial. All right. So what does heat do for delayed onset muscle soreness? Okay. So for DOMS, a heat wrap applied before a vigorous lower back exercise resulted in significantly less soreness post-exercise compared to a control group. So this was cool. They applied heat before doing an exercise, 4 hours before doing an exercise, and then had participants go through the exercise, and they found much less muscle soreness after the exercise as opposed to those who did not apply heat. All right. And then the heat wrap applied 18 and 32 hours after a difficult lower back exercise also reduced pain greater than cold therapy. So they had participants go through a vigorous lower back exercise and they had them apply heat at 18 and 32 hours after the exercise, and they saw decreased soreness compared to those who just applied cold. All right, so it looks like heat is a little bit more superior, especially for the lower back when it comes to treating delayed onset muscle soreness. Complications for heat therapy, they didn't find much. Minor burns and then skin pinkness. So if you're concerned about your skin turning temporarily pink, maybe stay away from the heat, but I think it's gonna be okay. All right, so let's put the two head to head. So heat versus cold, which is better? Which should you be gravitating towards? So heat wrap compared with heat wrap compared with cold pack for treatment of lower back DOMS. The pain relief scores were 138% greater in the heat group versus the cold group, okay? But there were no differences in physical function afterwards. So if you do a vigorous lower back exercise, it's better to apply heat than it is to apply cold for the lower back. All right, there was no difference in heat or cold for acute neck strains, so keep that in mind. And then they found that after a vigorous hamstring exercise, submerging the muscles in warm water as opposed to cold resulted in decreased muscle stress markers. So they looked at the different chemical components that go into creating muscle stress, and applying heat or going into a warm bath resulted in less muscle stress than it did with cold. Okay? So in summary, which one stands out, or what does the current body of evidence say for heat versus cold? Because there's definitely benefits to both. Okay, so cold therapy currently is recommended for acute ankle or other joint strains with inflammation. All right, and heat therapy is recommended for muscular pain and soreness, as well as for joint pain and stiffness. Okay, so acute joint injuries with inflammation, probably best to go with cold immediately after the injury. Heat is recommended for muscular pain and soreness, as well as for joint pain and stiffness. All right, so I hope that brings some clarity to the issue of heat versus cold, but keep in mind that pain is a pretty multifactorial process. And if you prefer heat or cold over one or another, I would go with the one that you prefer. Okay, me personally, after a hard run or a hard exercise, I really like the feeling of an ice bath, even though the research doesn't say that that is very beneficial, but I like it, so I'm going to continue to do it. Whatever you find to be the most beneficial for you, I would stick with. All right, I hope that provides some help. If you are experiencing pain or injury and you would like some help with the treatment process, we would be happy to help you. Please visit us at TruMotionTherapy.com to learn more or to book an appointment.